Neurons here release a burst of neuronal energy periodically, right? So that makes it a kind of pacemaker for the respiratory system. So we get these bursts of inspiratory neuronal activity, even when these are separated from inputs. In other words, you don't have to stimulate the DRG to inspire. The DRG just inspires all by itself, right? Now, its inspiratory signals are modifiable by the control system, but this is a instigator, so to speak. So that's why we call this the pacemaker, because this is the place where neuronal activity is going to begin each inspiratory cycle. All right. Now, the signal that we see is not like an on and off. If that were true, if the DRG just suddenly activated full blast, the diaphragm would essentially contract as quickly as it could, and it would be almost like a hiccup, right? Because it would try to contract so fast that it would be, and we wouldn't want to walk around breathing like that all the time, right? So instead, rather than a big full burst, we get a ramp. Okay, that's what this little arrow is. We get a big arrow and a little arrow, which barely fits on the screen. But those are our ramp signals. In other words, the DRG will start with a little stimulation, and then more, and then more, and then more, and then stop. And then start with a little again, more, and stop. Okay? So the stimulus, it starts weakly, increases steadily for about 2 seconds. Now, this time can change. Okay, so the 2 is not important. What's important is that it starts weakly and then increases in magnitude. Then it stops for a little while, at least 3 seconds. That allows for exhalation, right? Passive exhalation. And then a new cycle begins. All right, so we do this because it makes the diaphragm contract very smoothly to its maximum contraction. And then it's pulled back up as it relaxes by the lungs deflating. So we get a nice smooth inspiration, right? We instead of that rapid blast of trying to inhale all the air at once. So it makes us more efficient. It makes the lungs, it makes the respiratory system a little quieter, and it actually increases the total volume that we can inhale. Because if you try to expand the lungs too quickly, their compliance gets in the way and you start to lose energy. So this really is the most efficient way to stimulate the muscles of inspiration. So there's 2 points of control in this system. In other words, 2 things that can be modified. The rate of increase, in other words, the slope of the ramp, how quickly the small signal becomes a big signal. And then the limiting point of the ramp. In other words, where does the stimulation for inhalation stop? Okay, so those 2 things are modifiable. The DRG is going to work on both. The DRG and the pneumotaxic center together are going to control the off switch, right? The point at which the ramp ceases to increase. Okay, so that's our dorsal respiratory group. This is typically the group that is considered primary in the respiratory control system. Because if we don't have this, we don't have inspiration. If we don't have inspiration, we don't have respirations, and so on.